welcome you all. I wish the auditorium was full to capacity, but I understand the nature of our difficult winter too. The toll it's taken on many people, including myself. I've been sick for about 10 days. It is a extreme pleasure to be here and to welcome you all to hear a vision for healthcare in Hornell. Now you have to understand that this group of people here who are business and community leaders were called to duty by Jen in December, basically, I believe, to start this new visioning process. Jen came to us as an interim CEO at SJMH, I believe it was September or October. She hit the ground running, approached my office on the first day, and we began to arrange for community involvement, particularly rebuilding relationships with our physicians and our stakeholders, our employees, and our community. I don't think there's any question that the SJMH brand in many people's mind over the last several years had lost the luster for whatever reason, and those days are gone. You know, the reasons aren't important. What we have to do now is move forward. And we're getting an opportunity to do that and create a new healthcare vision in Hornell in a very difficult environment. And that environment is, reduced reimbursements and pressure on not only physicians but healthcare providers and service providers. But that's not to say it can't be done. There are successful rural healthcare models throughout our country. And there are probably some you can even point to in New York State that are successful. So this group here, these physicians and administrators, community leaders, industrial leaders, have answered the call of the community that many don't even live here. But they have stakeholders here because they employ people here. Their employees seek and need and demand adequate health care here in our valley. And we have, I would estimate that our area of influence for SJMH and is about 20 miles, 25 plus miles, maybe more in some instances, which includes a population of about 125,000 people. I would think that's a fair number of people that certainly deserve, require, and need healthcare services. And that's our mission, is to develop a model to provide that for you. What you hear tonight is not the end of what this work is going to continue. This work continues. We're only, a month into this process. We have to bring a lot of people and stakeholders together. A lot of those stakeholders are regulatory agencies, the New York State Department of Health, and others. And we need political support. To that end, I had some very, I believe, productive meetings with the governor's staff and the health department staff as late as yesterday morning. I even had a conversation with Dr. Shaw, Commissioner of Health in New York State. So rest assured when we leave here tonight that everything is being done that will ensure the needs and wants and desires of the healthcare environment that we require, need, and demand are going to be really, in my mind, achieved. But we have to work together. We have to build strong support from our physicians. We have to have strong community support for our hospital services. So when a physician asks you to go get a blood test, do that at St. James. If you have to have an X-ray, do that at St. James. You need an ultrasound, do that at St. James. It's just like anything else. It's almost like it is a business. I know we come to and we just assume, take it for granted that St. James has been there for 125 years. And it's always going to be there. But we have a responsibility as citizens, as regional citizens, to support that facility and to support its employees and support its physicians. And that's your job. We're doing our job, and we're doing it. These people serve at no compensation. They all have full-time jobs. They all run some may run major corporations, but they're here because they care. And I know you're here because you care. And I will let Jen begin the process. And remember, Jen's new to this. She's done, in my estimation, a fabulous job of rebuilding bridges and reestablishing relationships. And we're going to continue to do that. I haven't been on the St. James Mercy Hospital board in 7 years. But I was happy to come back because I know the value of health care. I know the importance of it. And without health care in this community, we don't have a community. So that is our mission. That is our goal. And with all my energy, and I know all the energy of these people here, we're going to make sure that happens. So without further ado, it's my pleasure to introduce Jen Sullivan, a young lady from Dansville. Graduated from Dansville High School in 91. 91. And,
close enough.
Graduated from the college with a bachelor's in accounting. Went on to get a CPA. She's worked for Arthur Anderson. She spent the last 20 years working in the healthcare industry in various degrees and positions, but most recently as Chief Financial Officer, Senior Vice President at St. James. I'm proud to call her a friend and a colleague, and she needs our support, and she needs our guidance, and what's beautiful about that, she's not afraid to admit it. And she's here to talk about where we are currently now, where we are currently in this process, and what we hope to achieve. Thank you.
Hello. Can you hear me okay in the back? Okay. I'm not really quite sure where to start, so I guess I'll start by talking about what I was hoping to accomplish tonight, and I think there's 3 things. One is to share with you the necessity and the framework for the new vision for healthcare in Hornell. 2 is to introduce you to the task force that is here with me tonight, and 3 is to seek your support. So those are really the objectives of the presentation tonight. I have a presentation, and I do hope you can hear me okay, because it helps me communicate what I want to do in the right order. So I hope that's okay with you. And I'll start by introducing the team that has come together to actually create the new vision for healthcare in Hornell going forward. Obviously, we'll start with the mayor who opened up the evening. So Mayor Sean Hogan agreed to help us with this task. Mark Darrow, if you could stand, he's the managing director of Alstom in Hornell, local businessman. Dr. Bruce McKellar, family practitioner in Hornell. Dr. Izzy Meir is one of our anesthesiologists. Stan Konopko is here as our financial advisor. He's currently serving as the interim chief financial officer at St. James, and actually started the same day I did because I knew to come into this role I needed to let go of some of the things I was doing before. Dr. Spencer Annabelle, internal medicine, native of Hornell. Next to him is Stuart Putnam, from Unity Health System, and he's actually here to provide tertiary perspective to the work of the New Vision Task Force, and Drew Sharma, the president of TTA. So thank you, please, to the team that has agreed to help me through this process. The next group I'd like to recognize before I get started are the physicians, our medical staff, who have come here tonight to support me and really truly do care about healthcare in Hornell. And if you could stand and we could recognize you, I'd truly appreciate it. Also, to move something this big forward, the board of directors actually had a resolution that asked us to form this visioning team. They truly do care about healthcare in this community, and we actually have 3 of our boards here tonight. We have our hospital board of directors, our foundation board of directors, and our properties board of directors. So if you could stand, please, I'd appreciate it. Thank you. Thank you to the community, and I know we have employees out there too, so I hate to do this, but it makes me feel better to know you're here with me. So employees, please stand up. Thank you. Okay, so I've already talked about the meeting objectives, so I think I can skip this slide and move on. I picked the picture, the path to the future, because I wanted to try to set this presentation up so the pictures would guide you through the concepts. So if there's a path, it means we're talking about the path to the new vision going forward. Okay? If there's a picture of the Capitol, it means it's something related to regulatory environment, something that's a challenge that we face. Doesn't mean we can't overcome it, but that's what we're talking about there. I have pictures of St. James because it talks about the model of care that we currently deliver, which is not a sustainable model going forward, and thus the reason we're venturing here on a new vision for healthcare in Hornell going forward. Our task is to come up with a model that meets what the community needs most of the time. The New Vision Task Force I've introduced you to. Here's a slide, shows their pictures. Clearly we could provide more information, but just a tremendous group of people. We do have the best of the best at the table, helping us develop a solution that will work far into the future. Not a short-term fix, but something that can keep us sustainable going forward. So here's the picture of the government, and you can see what are the trends that are impacting healthcare organizations. Why are we in the position we're in? And if you think about, there is a weak economy, but there's federal and state budget deficits, and when that happens, there's a pressure on your reimbursement. So if you think about it, we have a heavy Medicare, Medicaid population, and that means that that revenue comes from the government. So as the government pays us, and they face pressures to try to balance their budgets and address their deficits, we get paid less money for what we do. So that's a challenge that just keeps going and going and going. And it's not something that gets better, it's on a position where it's getting worse. And so you have to keep reforming, you have to revise what you do to address those declining reimbursements. The private insurance companies are responding to businesses that want lower health costs. So if you think about it, somebody has to pay. If the government can't pay the full cost of providing the care, then who picks it up? And in many cases, it's the private insurance companies. But if you think about it, if they're responding to lower their costs too, it's like a vicious circle. Recruitment and retention of personnel, healthcare personnel, is huge. And as time goes on, there's shortages. It's hard to find providers to take care of us. It's hard to recruit providers to our community. And there's a variety of reasons. And some people love rural communities, some people don't. The new physicians, for instance, out of college, many of them want the life of living in a city, and they don't necessarily want to come to a rural area yet in their life. So we face these types of challenges. And to be honest with you, one reason we're talking about partnering, and one big thing a partner can bring to you, a larger partner, is to help you with physician recruitment and to provide the specialists you need going forward. So if you think about it, you have someone who comes out of college. I'll just use an example. They're willing to help us some of the time, but they might not want to be here every day of the week. So they say, okay, I'll work for somebody in Rochester, and I'll come to Hornell once a week. So if we find 5 of them, then we can actually staff a clinic 5 days a week, right? And so that keeps consistency. Somebody's here every day of the week, and then they just rotate. And then they get a little bit of both worlds. And so it makes it work for us. Also, in a rural area, we don't have the volumes to cover their salaries. And so if we only have the volume where you need them 1 day a week, this provides a win-win because we can share them with a larger partner who has the financial resources to employ them full-time. Does that kind of make sense? And so that is one reason why it works. And then these specialists do what they love all of the time instead of in a rural community where they can only do what they love some of the time. Okay, clearly the demand for inpatient hospital services is declining, which is resulting in increased competition. If you have less inpatient care, then you have to compete for what else is left out there, right? And so you're seeing a much more competitive environment. So what must we do? We must compete on cost, quality, and patient experience. We must prepare to participate in accountable care organizations. We have to reconfigure what we do and how we deliver care to achieve cost efficiencies. And if you think about it, again, another reason to partner with a larger organization, scale and collaboration. If you think of integrating with a larger organization, we can't achieve the level of cost reductions we need on our own. And we need to be prepared to forge new partnerships. So now that's the end of the big landscape and what we're faced with in the healthcare industry overall. Again, the state and federal budget deficits driving a lot of the challenges we face and other rural areas as well. We're not alone. So we go to St. James. St. James Mercy Hospital as it stands today. We've struggled for years, not unlike our counterparts, to remain financially viable in an industry, a healthcare industry, that has this increased competition we were talking about, mounting reimbursement challenges. Again, as the state and federal government try to cover their deficits, the reimbursement per unit of whatever we provide is going down, making it more difficult. The national economic crisis, the decline for inpatient services, low utilization. So there's a lot of factors that make this such a difficult equation, and that's why I needed the help of this team, because it's not something you can sit in an office and do by yourself. You really need people to help you through this. Let me give you an example of how the industry has changed and how there's been really a fundamental shift from care provided in the hospital to more care being provided outside of the hospital. That does not mean we don't need inpatient care, and I don't want that to be misunderstood. What it means is that more focus is now on wellness and prevention, where you go, you see a doctor, they try to keep you well and prevent you from needing a hospital admission. And so as that transition has happened over time, you don't see as many people in the hospital. They certainly need it from time to time, but it's not where most of the care is being given anymore. So if we go back to when we licensed St. James Mercy Hospital, we were licensed for 119 beds, and there was a time we needed them all. And our average daily census now is 12. And so it's not a new concept, and I guess I wanted people to leave this presentation comfortable with that a limited inpatient presence is sufficient, because what we had in the past, an inpatient-focused model, is not what people are utilizing most of today, if that makes sense. So that transformation has already happened. It's not something that's going to happen. We're still operating out of a big old building that was set up for inpatient care, so it doesn't work in an efficient way for ambulatory care, if that makes sense. So that's another challenge. We've got to get out of the building we're in. So the new vision for healthcare in Hornell includes a new facility that's outpatient focused, that meets the expectations of the physicians and our patients. What we're providing services in right now doesn't meet your expectations. It's not outpatient friendly. We have parking issues and all these other things that might drive you crazy, and we know that, and we're trying to fix it. The next challenge I think I talked a little bit about at the beginning really is the fact that we have few private payers, and the bulk of our business and our revenue is coming from the government, Medicare and Medicaid. For every dollar we spend, they pay you about 86 to 89 cents on the dollar. So it is, again, it's an ongoing struggle. So what do you need to do? Lower cost. How do you lower cost by yourself? You can't, because you don't have the scale. You're not big enough to do it. So you have to partner with a larger organization to make that work. Our unpaid cost of Medicare and Medicaid, meaning how much did our expenses exceed our revenue, was over $5 million in 2012 and 2013. It was almost $6 million. That's just the shortfall in reimbursement. So you sit and you think, how do I fix that? And you can't fix it by yourself, and that's why it's such a huge challenge. And I gave you a little preview of this, but the situation is getting worse as the Congress tries to deal with the federal budget deficit. We're facing over $22 billion of more reductions over the next 10 years. So I think I've painted the picture enough that the model we're in today isn't working, it's not sustainable, and we need to change the model, shift it to the ambulatory focus on wellness and prevention, again, and only use inpatient care for treatment when it's needed for that. So I looked in our 30-mile radius and said, okay, so St. James is in the middle of that green thing you see on the screen, and then you have Noyes and Ira Davenport and Jones, and we're all in this area, and we all have our rural challenges, and guess what? We're all dealing with the same thing. Because I looked at all of our inpatient discharges and said, you know, I wanted to see, is everybody facing the same thing we are? And you can see this shows a 10-year decline in inpatient utilization. Again, it's showing that transition I was talking about earlier. Every one of us over the last 10 years has experienced declines in our inpatient utilization, anywhere between 34 and 61%. Huge. So I guess my point is we're no different than the others. We're all faced with the same challenges. I'm just happy I have a team like this to help me through a solution so we can ensure that we have an ongoing healthcare presence in Hornell and that we're able to maintain as many services as we can, what the community needs most of the time, and that we can preserve as many jobs as we can. So again, our challenge is great. And this new vision is really being supported by new and innovative thinking. It's not easy, it's very hard, very difficult, and again, a thank you to the team for helping me through this. In December, and now I'm shifting from St. James Mercy Hospital of today towards the new vision. Where are we moving from? Because there is a difference. The delivery model we have today is unsustainable financially. Now we're moving forward. This new vision task force is coming up with the healthcare presence that is sustainable going forward. So in December, our board of directors called for the formation of this visioning team. As you heard earlier, we have business professionals and leaders here. We have physicians, rural and tertiary healthcare experts, and financial professionals. A little bit of everyone to help inform the different pieces of the puzzle. And they're, again, committed to preserving as many services and as many jobs as possible. This business plan we're coming up with is actually a working document, and it will guide, think of it as a map, the transition from the St. James entity we know today to a long-standing community healthcare presence. Again, we're not looking for a short-term patch to get through another year or two. We're looking for a solution so we can continue to provide health care to this community well into the future. And so what are we doing? What is this task force doing? Well, we're looking at services, financial projections, regulatory requirements, funding opportunities, and the physical campus that will house the services. This is a work in progress. And so I'm not here to give you all the details tonight. You know, I thought about when is the right time to have a town hall meeting, and there's never a right time. I knew that people were interested in information. You wanted to know what's going on. I want to, and I support a transparent, open communication stream. And so I knew people might want the specifics. But I was willing to take the risk to say, I don't have them all, but at least let you know what we're doing, who's involved, where are we going. And I thought that you would appreciate that. We've already begun dialoguing with prospective partners, the larger organizations that can help us. They are very interested in our new vision for healthcare in Hornell, and we believe there are going to be many collaborative opportunities. But it's not something, again, that I want to wait till we have this perfect bow and tied up package. It's like, let's start the communication and go with it as we go so we can build on the conversations towards a sustainable future. I want to reiterate that we're keeping every option on the table. So I don't want anyone to think that there's been any decision about anything in particular as it relates to what's in the new vision, what's out. We're looking at everything we provide. Can we find a way to make it financially feasible? Can we do it? You know, is there a regulatory path? And this speaks to part of what Sean was talking about earlier. What we're talking about that will work going forward is like a hybrid. Some of it's outpatient, most of it's outpatient, but we're talking about a limited inpatient presence. Well, there is no such thing. And so then you got to create such a thing, and whether we can do it and what amount of time it'll take to do that, I mean, it sounds crazy, but it's true. And so Sean has already begun that work in Albany to help us start to work through those regulatory challenges. The definition of a hospital means you provide your care primarily in the hospital. Well, nobody does that anymore. So does that mean nobody's called a hospital anymore? I don't know, but I mean, so what we're trying to do is have something that's ambulatory focused, where most of everything is done now. The limited inpatient presence, because we do have an average daily census of 12. But there isn't a path to make that happen yet. So that's where the creative, innovative dialogue and discussion is occurring. Because we have limited resources, we need to match what we can afford with what we need. We are committed as a team to coming up with a recommendation that addresses what you need most of the time. A new facility, again, is part of the new vision for healthcare in Hornell. And we are working very diligently to complete the business plan in March or April. So I guess we're in mid-February now, so it's been like the craziest thing you can ever imagine. We just work constantly. But it is taking shape, and I want you to know that. Our business plan will present a compelling and complete vision for healthcare in Hornell. We need this document with all the pieces outlined. How does this work? And where does the bigger partner fit into the picture? Where do we fit in? What do we need from each other? How are you going to pay for the new building? All those pieces we're trying to think through and outline in the business plan, because that's what we're selling to the partner. We want a partner, a larger partner, because we need them. But we also want them to commit resources and invest them in our growth and sustainability. And we want a partner that shares our dedication to seeing high-quality care continue in Hornell. So then you ask yourself, well, why would a tertiary partner be interested in Hornell? What's in it for them? Well, they can access our patient population and our physicians, our talented physicians, and they need both of those to make the accountable care models of care delivery work going forward. So there is a fit, there is a reason. Also, greater referral opportunities to the tertiary partners. So I don't want you to think that, they need us too. They're not uninterested in us. The question is, can we find and deliver and communicate a business plan that shows how can they help us without them taking on all the financial risk that you see that we're faced with today? How else can they help us? So now I was talking about what we can do for them. What can they do for us? Well, they can help us build our financial strength. Remember how we were talking about scale and integration? You need a larger partner to lower your cost structure. They can help us with physician recruitment and clinical program development. Again, we talked about that earlier. If you share resources, and they can hire a bunch of people that have a huge amount of people that do the same thing that they can network with, and maybe they don't want to be down here every day of the week, but they're more than happy to come down one day a week, it makes it work. They can offer us better technologies. Think about electronic medical record and all those things that you need going forward. I mean, there's certain systems that are great. Let's use Epic as an example. They wouldn't even sell that to us because we're not big enough. So you might say, well, just find a way to buy it yourself. Well, in that case, you can't. And so if you want to integrate yourself with a large organization, the best way to do that is to kind of use the system they're on. I mean, if you think about it, some of it's simple, but it's not simple to make it happen. And then they can offer us a transfer relationship. There's stuff we don't do here and we'll never do here. And so you want a relationship that says, we have a trusted partner that we have confidence in, and we know they provide high quality care, and they'll take care of us for all the things that we don't do here. And so that is another benefit that they can help us with. This is a slide I took from a Haney's presentation, and it talks about future success factors. What is the emerging success model? What does it have in it? And when you look through this list of what an emerging success model has in it for healthcare, it's the scale and integration we talked about. It's aligning physicians. It's the IT systems. It's all these things that we've talked about this evening. So that gives me confidence that what we're doing as a New Vision Task Force is on the right path. So what next? What is the New Vision Task Force doing next? We're going to complete our business plan, as I mentioned, in March or April. When it's complete, we're going to present it to our board of directors and then to the prospective tertiary care partners. And then we're going to come back to you and give you more specifics, which I know you're eager to get, and I wish I could give you more information tonight. The honest fact is I can't. I don't have all the detail yet, but I can commit to come back to you as soon as we have more information and bring you another update. And stay out here in front of you, answer your questions, and let you walk the walk with us. So what does the New Vision mean for the community? Again, I know I mentioned this earlier, but it does include a new state-of-the-art, fully equipped healthcare campus with a complete scope of ambulatory services. Again, where we are providing our care right now is not meeting patient and physician expectations. It's inpatient focused. And because of the way it's set up, we can't achieve the cost efficiencies we need to help drive the cost down. So this actually supports that as well. And I think I mentioned earlier that the capital investment in the existing facility wouldn't be justified. It's too old. It would cost a miniature fortune to renovate what we have today for what we need tomorrow. So it is less expensive and more rational to start over with a different building. And so in terms of the transformation, what does that mean? It means we're going to continue to aspire to a presence that meets your needs most of the time. We're going to continue meeting with partners or prospective tertiary partners to gain their assistance in fleshing out this model. What works for us, what works for them? How can we find some balance to make this work going forward? We're going to continue to work with Sean and others to navigate the regulatory process. And we're going to begin planning the house that will efficiently house our services. So we're planning for all these parts at the same time, and we're juggling a little bit of each. So what do we do in the meantime? And we have to continue focusing on providing high-quality care. And that's where it goes to the great staff in this room. You know, we have to continue doing what we've done well for 120 years. We have new initiatives that are already driving us forward towards this new vision. We opened the Center for Orthopedic Care in January. We're opening Express Care in March. We're working on a Center for Patient Access and Progressive Care. All these centers, but they all make sense going forward. So if I take one at a time, and I am almost done, I promise, and then I'll turn it over to questions. Our Center for Orthopedic Care opened on January 6th in partnership with Rochester General Hospital. So as all of you probably know, we have comprehensive, specialized, high-quality orthopedic services here, 5 days a week, with call coverage 24/7. Great success. The ramp-up has been so fast, and I mean so clearly the community needed this service. They're using this service, and it's working out very well for us. The Center for Express Care, we've heard loud and clear from physicians, from employees, from board members, from all of you, we need more access to primary care. We can't always get in as fast as we need to. Sometimes, you know, what about if we just need we have a simple common health issue and the doctor's office is closed and we don't want to go to the ED because the co-payment's too high and it doesn't make sense to be in an emergency room because it's not an emergency. So what's the option? And so we heard you and we're opening Express Care at the Elm Street location on March 10th. That'll be open noon to 10, 7 days a week. So hopefully that'll address that need and help supplement your access to care and your walk-in care after hours when the doctor's offices are closed. But what does that mean? The ED is still open. If you have an emergency, you still go to the ED. And even if you went to the emergency room for something that wasn't an emergency, they're not going to turn you away. So, I mean, I don't want you to think that. We're trying to do this to supplement and provide more access to more primary care, which we heard you wanted and that you need, and I believe that. Center for Progressive Care. This is expected to open on March 3rd. It's on our 2 West unit. And it allows for a higher level of inpatient quality as we transition to the new vision. And I'm proud to say the nurses at our hospital are actually taking the lead with this to help us improve quality of care and make this work for us. In this transformation, we want to provide the best quality care as we can. And so improvements are part of our everyday life. And so thank you to the nurses who are actually making this a reality for us. They're doing a yeoman's job. And then the Center for Patient Access. This is a welcoming area and process for all our ambulatory services. We're trying to standardize the intake process to make the experience for you more pleasant and convenient, more user-friendly for the physicians, and it's part of our physician outreach initiative. Better service, customer-oriented for both the physicians and the patients. And so all these things, we've heard you, and we are making changes. I want to assure you we're providing high-quality, compassionate care. Our emergency department and anesthesia department are staffed by doctors. We rank better than the national average in readmission rates, length of stay, and post-surgical infections. And we have excellent patient satisfaction scores for ambulatory surgery. We compare favorably to national benchmarks of quality outcomes. We have an incredibly committed staff. We rank among the top 10% of hospitals statewide for quality and patient safety improvements. And our nursing home has achieved a 5-star rating. So what can you do? You can take our message and share it with your elected officials, your neighbors, your friends, your family, that we are still here providing high-quality care, and we're transforming to meet the needs of the community, not a short-term fix, but well into the future. So keep supporting us. Turn to us for our healthcare needs, and please, support us as we transition to this new vision because we need you. And so with that, again, I'd like to acknowledge and thank all those who are here to support us tonight and to help me develop the new vision, the task force, the board of directors, the physicians, the employees, the community. Thank you to the school for allowing us to use the auditorium. There's just so much thanks to go around, but together, we will achieve our new vision for healthcare in Hornell. And with that, I'd like to stop and address questions, and hopefully I'm doing okay. I'm doing okay. And hopefully that gave you some updates that you find helpful. Okay.
I thought your discussion was very good, and actually, as I listened to Mayor Hogan, I think I might vote Democrat the next time. Here's the thing I'd like to bring up. How much of your periphery have you lost? People from Woodhull, Jasper, they're not coming here anymore. They're going to Wellsville, they're going to Corning, and they're going to Danville. And you can't build up anything unless you have enough population. The mayor says 125,000, but there are 3 hospitals fighting for them. And that is actually, we have 3 hospitals in a very limited area. Going back to the 60s, if that hospital had been located in Geneseo, as some people wanted, that would have helped us because we would have a 36-mile river. Well, we don't. But I think apparently you used to have some clinics, certainly at Woodhull, and I think there was a clinic at Greenwood, but you apparently closed those. So I think you're going the wrong way. I mean, if you have clinics with nurse practitioners, and they take care of the little stuff, and then when people have the big stuff, they come here. But if you got people from Woodhull was very strong surgeons. And then the second thing you glossed over, you don't have the staff you had. We used to have 5 surgeons, 3 urologists, 3 ophthalmologists. You don't have that anymore. We don't even have 1 full-time ophthalmologist anymore. And you cannot just run a hospital with family practitioners. You need, yes, I know what you're saying. You're hoping that they'll send down cardiologists and gastroenterologists, etc. But you need those services here so that you can attract people. You know one thing in your advertisements, I find it peculiar that you never had one advertisement for your cancer center. Not one. I know they don't belong to the hospital, but they do provide a service. And you have some other physicians who still admit to the hospital. We're the only hospital in this area where the doctors don't go to the hospital. Dansville they do, Wellsville they do, not in Hornell. Now, Elmira and Arnold Ogden has a mixed model. They're, what's his name? Their hospitalists take care of the patients at night, and the regular doctors take care of the patients in the daytime. Psychologically, I think people feel better with the doctor they like. There's a little caution about being treated by strangers. But I really think to survive, you need a larger population area, and somehow you got to get some of it back. But thank you. Thank you for listening. Now, for instance, I see Dr. Anderson, he's still alive, I think. we had four interns, and he's a survivor. That's good.
It's very good. You brought up a lot of great comments, and I agree with you. It would be great if we could staff those clinics. I think there is community need in the outlying areas. The reality is, as we approached resignations, et cetera, we had an incredibly difficult time recruiting, and we actually couldn't. So the closures were mostly driven by our inability to find staff to staff them. And so it was a cold, hard reality, and I agree with you, it's a need. That being said, I think we also need access to more specialized services, and I do honestly believe that through a partnership with a larger organization, we'll get more of what we need down here. And so I think we just need to keep our chins up, keep trying to work at that, and I think we will get what the community needs. I agree with you 100%. We need to recapture what we've lost. I think it has not done, it has impacted us in a terribly difficult way. But nonetheless, I think as a community we can come together and we can address that. So thank you for your comments. I do appreciate it. Dr. Horry?
I'm the individual who started the clinics in Greenwood and Troopsburg. Started the Greenwood Clinic in 1977, the Troopsburg Clinic in 1978, and supported the foundation of the Cameron Clinic about 1979 or 80. Primary care is the foundation that every hospital is built upon. Without a solid primary care foundation, you're putting on the roof, you're putting on the chimney without the foundation to support The clinics are fine, but I think personally that your efforts should be at least 80% toward working for primary care. As you now know, I work in Bath and Wellsville. Wellsville has well-established and functioning clinics in Belmont, Andover, Bolivar, and there's a fourth one. And I think that St. James needs to look at why. Why did all these providers leave? Why has it been so difficult to get providers to come here? When a facility is not far away from here, had more success. I think this meeting is an excellent start. But I think that we need to get the priorities straight. The primary care is where it's at, and primary care is dependent upon getting the providers who can deliver that primary care. Thank you.
Thank you.
Jen,
Yeah.
I haven't seen or heard any mention of some of the behavioral services that we've lost, primarily the psych unit services for adult and adolescent. I think we all can recognize that that is a big need in this community that's now gone. And I would hope as your team looks at this remaking of our vision and our model, how do we try and get some of those services back, or what are we going to do to fill that gap that we don't have any more of those services?
Yeah, the inpatient psychiatry units did close in December, and it was a very hard decision to do that, and that was financially unsustainable. And so that is another example. It's not something that I can say the community doesn't need, but it was contributing to our loss situation, so it wasn't sustainable. That being said, I think what we need to do in that area to move forward is advocacy, a lot of what the mayor is doing, but it's not something that is financially workable in our situation right now. I do know it's consistent with what we're seeing across the state for the same reason. Again, it doesn't help maybe it does help a little bit to know we're not in this alone, but it still doesn't address the need, and I hear you, and I just don't have an answer for that as we sit here today. I don't know if anyone on the team has any thoughts on that.
Jen, I think I could speak to that. New York State this past year has systematically disenfranchised the medically ill. I'm sorry, the psychologically ill. There are people that don't have very many votes. Sorry, is that better, guys? Yeah. Okay. New York State has systematically disenfranchised care for the mentally ill. These people don't have many votes. They're closing psych units right and left. Elmira Psych barely escaped closure because their citizens basically did a grassroots thing, had a big demonstration. They basically cut the heart out of a reimbursement. Continuing to provide inpatient psychiatric care was not financially possible. It was a hard thing to do to close a unit that had been built a year before. And this is exactly what they're doing. I mean, senior citizens get angry. They're very well organized. You don't want to make the AARP members angry. The mentally ill have no voice, and they've been an easy target. And their care all across New York State, they have been disenfranchised. And it's a huge problem that right now we have no financial ability to deal with, as sad as that is.
Thank you.
Good evening. My name is Frank Rizzuto. I am not a doctor, so I would like to say something about a different attitude here. I'm not a native of Hornell. I came to live here 29 years ago. And at that time, there was a huge capital campaign going on as far as the hospital was concerned. My wife and I got very involved in it, and we worked for it, and we were very happy to do so. But we ran into a controversy that we had no knowledge of whatsoever. It was the time that the Bethesda Hospital was just closing up, and there was a tremendous amount of dissatisfaction with that episode. We didn't know that. And we had to deal with people who are far more interested in seeing their Bethesda Hospital maintain itself than they were of the growth of St. James. Now, I'm extremely pleased to see the number of people here tonight. I think that you should be very enthusiastic about all of this attendance. However, I have noticed that there is a faction in Hornell that seems to follow in the same footsteps of the people that used to love Bethesda Hospital. There is an antagonism about it. For whatever the reason, I don't know. And I think it's necessary now to gather these people in. And it can be done. If everybody here tonight could go out and see or talk to people who they know have some kind of a gripe against the hospital and bring them into the fold, then you'd have a tremendous amount more support than you have now. And you've got a lot of good support right now. I'm very, very happy about the program that has introduced people to what the hospital is doing. I'd like to see that extended. But I think everybody here has to get into the act. Thank you.
Well, Frank, I won't be as eloquent as you, but I'll do my best. Turn around, you'll see who it is. Larry Jones from Markport. I'm not a doctor either. Can I have 2 questions? And the first question is a 2-parter. Number 1, maybe a lot of people in this audience already knows the answer to this question. Are we still affiliated with Sisters of Mercy or was it Catholic East? If so, what will that relationship become? That's number 1.
Okay.
So remember that. Okay, number 2 is an economic question. As a small business owner, many of us small business owners are extremely concerned of the employment situation in the Hornell area. We have watched over the years as these particular positions are cut, these services are cut. It means employment. Us small business owners live and die by St. James, by Alstom, by TTA, by all the organizations. For money, the state, workers, and what have you. That money coming into the area, then it gets circulated. When the money's not coming in, there's no money to circulate. In your planning on this vision model, do you have a handle on where those employment figures may be? You're talking about efficiency, and unfortunately that's a nice word to say we're not going to have jobs. I'm in business, and I know what it is. When you make things more efficient, you automate and you do it without jobs. Okay, all well and good when you own the business, but when you're an employee, it's a huge concern. I want to live, I've lived in this community all my life. God willing, I'll live here another 30 years, and I would like to see the economy stay as strong as we can make it. So, 2 questions. Do you remember them both?
I can. Okay, which one first? I'll answer the Catholic Health East question. Then I'll answer the question on the jobs. And then, where is Sister Fran? Will you help me with the Sisters of Mercy? Thanks. Catholic Health East is still our parent, and so yes, they're very much involved with us right now. I do not see them as being part of the new vision for healthcare going forward. I see that parent organization, which is more national in nature, transitioning to a partner that's more regional and more local. So, you know, more Rochester driven, if you will. So yes, CHE is there. They're very supportive of the transformation of healthcare in Hornell. They're actually facilitating it in many, many ways, but do not see them as part of the future. That being said, in terms of the question about jobs, I hear what you're saying, and I think the detail that will go or come with that will really be the services and what will this business plan, you know, what will it include? And what can we determine that is sustainable and viable from a financial perspective? And so once we have that level of detail for the services, the employment needs would then need to be matched with that. So I agree there will be an impact, but in terms of what or who or how, I really can't answer that today. And not because I don't want to, I just truly don't know. With that, I'll ask Sister Fran if she can answer to your question on the sisters.
As you all know, we used to have quite a few sisters that worked in the hospital. And as our numbers are getting fewer and our members are getting older, we've had to look for other ways to kind of hand over our ministries. And one of the things that we did years ago in joining Eastern Mercy, which then became Catholic Health East, was to look for a bigger, stronger sponsor that could carry on that legacy for us. I think our most important goal right now is to do whatever we can with Jen and this New Vision Task Force to try to ensure in whatever way we can that the healthcare needs of this community are going to be provided for. And other than that, I don't know how much more we would be able to stand here today and promise. So we're working diligently alongside them to try to reach that goal.
Make a comment. I'm Dr. Rhonda Peterson. I just wanted to make a comment about concern about a comment about the employees and jobs. I think what you will see, the number of employees that are employed and working inside the institution will decrease, but hopefully outpatient services will increase, which will increase jobs in the outpatient sector. People will have to learn new positions, new jobs, but I think there will still be plenty of jobs in this community.
Yeah, Larry, I too, like you, was born and raised here. In fact, there was 8 members of my family, including myself, were born in St. James. So certainly have a vested interest in St. James and its future here. Certainly I am well aware of economic development issues. I have, in my tenure as mayor, seen the peaks and valleys and how it hurts a community. It can help a community. And then we've ridden the wave of Morrison Knutson's 1,500 employees to great heights in the business community, enjoyed that. And then we rode the wave down to Amarail, a company that was formed out of bankrupt Morrison Knutson, where it went to 75 people. And then we had the euphoria of GEC Alstom signing on in 1997, and going from 75 employees again back to 1,200 employees. I don't know if we'll ever see 1,200 employees again at Alstom, but I do know that they have significant amount of work, and they're continuing to hire, and they're continuing to seek work. At last count, they had about $600 million worth of backlog, Mark, if I was correct. So they're moving in the right direction. The first thing we know as community leader and business leader, without health care in this community, we don't have a community. Do you think Alstom would be able to recruit another engineer here if we told them we don't have health care services? Not by a long shot. So we all have a lot at stake here in this area. I have 8 grandchildren, 6 of them live here. And I don't want to think about having to send my grandchildren on a winter night at 3 a.m. in the morning with a high fever, 20 miles to Noyes or 35 miles to Jones for emergency care. That's not going to happen. And none of us signed on here to be involved with the demise of St. James. That's not the case. If we thought, any of us thought for 1 minute that this wasn't going to work, we wouldn't be here. Because do you think that we want that? We want that to be our legacy? After devoting my life to this community? It's not going to be my legacy. So you know, you have my guarantee and the guarantee of everyone sitting up here that we're going to make this work, we're going to find a way to make it work. This is a new path for all of us. We have regulatory challenges, we have issues we have to address. My conversation with Dr. Shaw, Commissioner of Health, on Monday afternoon in Albany, and he said to me, he says, this is not a problem, it's an opportunity. So that's the way we have to look at it, and that's the way I'm looking at it, and we're going to present the best model that we can. Understand me, because I've been at this for 1 month. So we'll get there, and you'll have our guarantee that we're going to get there, and we're going to present the best model possible, the one that's sustainable for our community. And I really want to thank you all for coming, for Jen to put herself in the situation that, you know, she's just new to this game, but I'm telling you, I've got the greatest confidence in her for what she's been able to accomplish in such a short period of time.
Just a comment about how we can help maybe get more people, doctors, into the community. I think we should continue to emphasize the work that our fire department does, especially all the fine EMTs that we have. And many of you have probably used them in the past. And I think they should somehow maybe be incorporated into this new vision, either somebody from the EMT or the fire chief. So continue to do what you're doing, but reach out more to the community, and I'm sure Sean can help us do that.
Hi, my name is Shelley Stevens, and I wanted to take a moment to recognize and appreciate what it takes to take on an entire community, as new as you are in your role. Communication is key and will always be key in any big business. And to head straight into this storm and go for it, to fix it, and to give it your all, takes a lot, and it's very much appreciated from the whole panel. But you as well, Jen, as you've had to be the face and the leader to go forward. I'd also like to acknowledge that I'm a patient of the Canasteel Valley practice, and the communication that happens between St. James and that practice is seamless, especially procedures that should take 24 to 48 hours, and sometimes they turn it around in 3. You can see that you're trying. If you're really looking to see for change and you're looking for the opportunity and the positive and the advantages, you can find them, and they're really stellar. So thank you for what you're doing. It's appreciated. Thank you.
Okay, well, thank you for coming tonight, and stay warm. Thanks.